what exactly RCM is. Then we talk about empanelment tariff revision, pre-auth and final approvals, then cashless claim submissions, query management, collection and settlement, and also all this put together will be talking about the effective measures of a smooth RCM process for us. So if you look at revenue cycle management, what exactly is revenue cycle management? In very simple terms, if we put it, it is the end-to-end management of credit business in a hospital environment. That means we deal with multiple credit agencies. One is basically the largest of that is the insurance companies, and then we have the corporates that we work with. Most of them work with us on a credit basis. So managing the credit businesses from the beginning to the end is what is an RCM is called, or the revenue cycle management is called. The goal of RCM is basically to ensure a smooth process flow, which makes sure that the whole process is done seamlessly and the related functions are under control, and we will be able to get the desired results for all the stakeholders within the ambit of it. So basically, revenue cycle management requires a collaboration between various departments within the hospital, like the front desk staff, then the healthcare promotion team, then the doctors, the billing staff, then the finance team. So it's a teamwork that actually puts the RCM work running smoothly. Earlier, the credit business was handled by different departments, like operations was to an extent handling some part of the revenue cycle management, administration was handling a fair part of it, then finance was handling the settlement and the collection part. So there were different departments managing it, and that was actually creating a bit of trouble because the communication between these departments was very critical, and if that doesn't happen, then the whole show will be failing. So the idea of revenue cycle management started when these kind of issues was creeping up. So we put together a department which is revenue cycle management, which is basically, as we told earlier, which will handle all the aspects, right from the pre-auth to the final discharge and the collection and the settlement. So it's a pretty large process which has been put under one umbrella so that there is enough and more control in the whole spectrum of it. So the first part of it is empanelment periodic tariff revision. Empanelment is for hospitals who has not been empaneled with the insurance companies or the corporate, so that is where it all starts. And once if there is an empanelment, there is a periodic rate revision which we need to go approach them for increasing our tariff with them. Both are pretty tough processes because initially when we want to empanel, there's a lot of negotiation happening, there are a lot of time delays that happens. So end of the day, unless and until you are empaneled with a TPA or an insurance, you will not be able to provide a cashless service to any of your patients. See, the current trend that we are seeing is on a larger hospital base, we are seeing around 30 to 35% of our revenue coming from credit businesses, which is substantially large for us to ignore. As we go forward, the penetration of insurance is becoming much larger. So you will at some point of time see probably 40, 45 or 50% of your revenues coming in from insurance or the credit businesses. So it is on us to decide whether we want to get into that business or just be with cash businesses. But if you are looking at larger volume businesses, obviously this is one area where we need to seriously look at. So how we manage these empanelment is one, we need to spend a lot of time with the insurance companies and the TPAs to get these prices approved. And also the current trend is the insurance companies are asking for packages. Packages where, we usually put packages for non-emergency cases where it can be managed at a specific tariff. And the idea behind that is the management of packages are much more easier. Because then we all know that what is the package for. So if we say we are doing a hernia surgery, we know that this is the package. So you can manage your resources within that. And that actually helps you in submitting your bills, your processing, your approvals, everything is faster. Your approvals will come, your collections will come faster. The whole cycle will become much faster when you are able to give them packages. And the other part of it is the schedule of charges, or which is called SOC, which is our open rates, which will be the room tariff, the theater tariffs, and those kind of things come under the SOC part of it. So package rate, providing more package rate is actually helpful for the whole organization as well as the patient. The biggest beneficiary for a package rate is the patient, because for an open billing, there are deductions from the insurance side. Basically, they call it as non-medical or non-approved items, which is not part of the packages. The packages is an end-to-end approval. If you have an 1 lakh package, you get 1 lakh. If you go for an SOC, there is an average of 8 to 10% reductions because of non-medical, because there are a lot of usages that we have in a surgery or in the regular businesses. They are categorized under the non-medical part of it. So that will become a bit of a challenge for the patient, because he will end up paying out of pocket even though they have a cashless facility available. So the basic challenges we see in empanelment and the tariff revision is, one is the process is time consuming and there is a rigorous follow-up which is required. The second is the delay in accepting the revised tariff by TPS insurance, because the more you bill in the previous rates, it is actually beneficial for them, so they sort of lag on that. And the businesses is divided into the insurance companies and the TPAs. The TPAs actually has a limitation in accepting a revised tariff, because they have to get a concurrence from the insurance company, so that takes a bit of a time. So we need to continuously follow up and do that. And then there are a lot of insurance companies who are very hard negotiators, especially the large insurance companies like, I don't want to take names, but there are a lot of them who would do that with us. So basically, if you look at this process of cashless, it starts with the pre-auth part. Basically, once the patient or the bystander provides us the basic requirements, like their documentation, details are given to us, then we start the process something called the pre-authorization, which the doctor writes the pre-authorization, and then we attach all the required documents and send it to the TPA or the insurance company for an initial approval. That's called a first approval, which is not the final bill amount or the expected amount. See, this is just if we have a pre-auth sent for 2 lakhs, then probably they might give you an approval for 50,000, and then we have to ask for an enhancement to get the final approvals done. So the cashless request goes, and basically the critical parts in that is we need to talk about in detail the proposed treatment, the estimated expenses, the comorbidities, if any, the duration of the illness, the copy of the EMR, and the patient's medical conditions has to be explained. See, most of us face challenges in that, because the doctors would write most of it, but then if there is something missing, the insurance company comes back and asks us a query. So there is a lot of time which is spent on the initial submission, then the query, then we go back and forth with them multiple times, and then we get the initial approval. Then the patient is taken in for the treatment. So for emergencies, nothing of this would matter. We admit the patient directly. And if it is a planned surgery, then we would always prefer to have the pre-auth in place before we take the patient in. So the verification of pre-auth forms. We have a system where we call, there are doctors available with us, whom they are called as insurance medical officers. They check all the pre-auths so that we know that the forms are complete in all respects, so there is least chances of query coming into us. So the pre-auth submission has to be done on priority, and any delay in a pre-auth will actually impact the later treatment as well as the final approvals. So the pre-auth major challenges is the submission delays due to various internal reasons. See, pre-auth submission delays are purely internal. We cannot blame anyone else for that. Probably we may not have the complete documentation, or the doctor is busy, not able to write the pre-auth. He's in the theater, so all that matters. So that's all mostly 99% internal issues. And then we also see a lot of queries being raised by the insurance companies or by the payers. Many of them are insignificant. The whole data must have gone, and they will still ask you questions just to delay the whole process. Then there can be documental errors. And then also when we submit the bill for the final approvals, there can be queries against the final bill. That could be on the rates, or that could be on the treatment, that could be on multiple other aspects, the discharge summary. There are a lot of things that they can ask these questions on. So basically then we move on to the claim submission part. We need to have a checklist where we are very clear that all the components that required to submit the bill properly are there with us, and we need to ensure a proper and timely submission. See, most of the insurance companies and the TPAs has specified time frames or tags for that. It is usually in the range of 3 to 5 days. So once the patient is discharged, within 5 days we should be able to submit the claims, so for them to process it. So we need to be very, very clear that all the documents are in place. The second aspect to the claim submission is the query management, which is a large chunk of it. We need to check all their portals and emails to figure out if there are any queries raised on any of the claims that we have submitted. And we need to reply the query within 3 working days, and then we need to track the queries properly to have a clear understanding on that. Then the last but not the final part of it is the collection and the settlement. This is one very core function, because end of the day we all need our money to come in, and that actually otherwise impacts our cash flow. So obviously there is a lot of focus on the collection side of it. So we try and do things which helps us to collect the money within the agreed MOUs. It could be 15 days, 30 days, 45 days, whatever that may be. Insurance companies is more or less between 15 to 30 days. So the process for collection is basically we need to send out all our reports, basically the AR reports, to the TPAs and the insurance companies on the 5th and 20th of every month. The 5th is the first one, and the 20th would be an updated one, which is as a follow-up which we send. And the RCM team visits them on a very frequent basis to make sure that the follow-ups are done, and then it is taken care of and the collected on time. And then what we look at is the challenges in this is the delay in uploading the settlement in the TPA portals. Then there are partial settlements and delay in settlement of top-up claims. So there are multiple aspects where we would be challenged. And we get into the final part, which is the effective measures for a smooth RCM process. Basically, the SOUP has to be completely adhered to. So that gives you a clear understanding whether you are following the process. Then the training is quite critical. We need to train all our people so they are all in sync with the requirements, on the same page for that. And then we need to regularly reinforce that the SOPs are reviewed and done, because there can be changes from the insurer side or the IRDA side which we need to take care. And then analyzing the RCM reports will give you a lot of data as to what we are doing rightly, what we are doing wrongly, and accordingly we need to keep changing our processes. So then we also need to look at some of the automation wherever possible. If we can clearly track the dispatch processes, bulk payment, bulk upload details. There are multiple things that we can look at. So there are softwares available today which will help you track all this. And also the understanding about the TPA portal and regular meetings with the TPA and the insurance companies would actually help us run this operations quite smoothly. So some of the basic details is documentation is the key. The transparency in billing and adherence to agreed rates will help us getting our claims approved on time. Then effective query management, sharing of account receivable, follow-up. These are some of the major things that we should be following to make sure that the process is seamless, and we also are getting our payments on time, and also making sure that the patient is managed well. Thank you.